Let's talk about partial bed bath. All right. Hi, everyone. This is Stephanie. If you're not used to my page, I'm the owner of Healthcare-Edu. All of my information is in the link. So I'm going to get right into it. We are going over the Prometrics Checklist and for people trying to pass the CNA State Exam. And what I'm going to do, I do have partial bed bath video where you see the skill, but I kind of want to just post a video about the supplies that you bring into the room and also kind of some things to point out on the checklist. So I am going to share my screen. And again, this is for the partial bed bath, which is on page 8. So this is the Prometrics, if you look at the title, Prometric Clinical Skills Test Checklist. It's on the Prometrics website. For my students, I have them printed out and bring it to lab, and we kind of work off of it and make a template. So let me get my annotation tool out. What we're going to do here, we're focusing on this one, provide resident with a partial bed bath and back rub. This is by far probably the longest skill. So some things I want to point out to you. This checklist is basically what the evaluator has to see if you are doing what they're going to look and see if you've missed anything, okay? So I will read this to you. Basically, it's not a full bed bath, and some of you have asked me to post a full bed bath video. I will definitely do that. They just want you to do enough to demonstrate that you know the technique. Again, I have posted this video where we're actually doing it. So let's go over some things to point out, and then we're going to go over supplies. So I'm going to read supplies that you bring in, that you gather and bring into this room. I'm going to go over that and say it twice, and then it's a video, so you could definitely, stop and record it. Because part of the skills, you have to go to your linen closet and bring it in. So I have my students write down the supplies. So you're going to get a gown, a bath blanket, 5 washcloths, 3 bath towels, a hand towel, basin, soap, paper towel, and gloves. Let me say it again. A gown, bath blanket, 5 washcloths, 3 bath towels, hand towel, basin, soap, paper towel, and gloves, okay? That's what you bring into the room. Also lotion. And so if you notice, when you watch my video, I have people with the thermometer. And so Prometrics has said that they don't use the thermometer. So we're going to talk about how you check the water. You're just going to check the water. Okay. So again, at the end, definitely watch my partial bed bath video where I'm actually doing the skill if you haven't seen it. So of course, the greeting, and I will post what your start and finishing up steps are. But let's look at asterisk number 3. Here, the water safe temperature. Any skill that has water, you check it first with your hand, and you will say something like the water is an appropriate temperature, safe temperature. For your note, the water temperature for bathing is 110 to 115 degrees Fahrenheit, 110 to 115 degrees Fahrenheit. So you check it, and then you have the patient check it with their elbow, and you'll see that in my videos. So that's something I wanted to point out there. Again, you'll read this because this is what the evaluator's checking. Number 4, with the eye, it's 1 washcloth. And you have to remember your index and your pinky. So you go inner corner, outer with the index one side, flip to your pinky, inner eye, outer with the other. So basically it's 2 spots on the washcloth. So you're not cross-contaminating, like say if somebody had pink eye, bringing it from the left to the right, okay? Again, you'll watch the video there. There's nothing else I want to point out. So the 5 washcloths, the eye, it then goes in the hamper. Then you have 2 washcloths, which you hang on the side of the basin, and you use that for the whole interior front of the body. So you use that for the face, the arm and hand, the chest and abdomen. And after that, those go in the washcloth, in the hamper. You then change the water. You have to exit the room, meaning you have to put the patient in the safety finishing up steps. You exit the room, get clean water, and you have 2 more washcloths so you could clean the back, okay? But definitely check out and watch that video. So I wanted to point out the supplies that you bring in, The video is super helpful. And so all the areas, the eyes, you use no soap. The face, you ask them if they want soap, and everything else, it's soap, rinse, pat, dry, lotion. Soap, rinse, pat, dry, lotion for all the body areas that you check. Watch the video, and I hope this helps, okay? What else did one thing I wanted to bring up, number 18 here, use lotion to provide back rub with long gliding and circular motions. It's not this, okay? That's PT. And although it may seem like we're being a little finicky, PT can actually be harmful and you need a doctor's order. A patient can have a blood clot and you actually dislodge it, meaning you move it, which can cause injury, or they can have a bleeding disorder. So massage is this, circular motion, okay? That's the massage. And then you'll go into your finishing up steps. All right, so I hope this helps, and I'm gonna work on doing all of the checklists, okay? So go ahead and watch the video of me actually doing this skill.